Hi, can you please state your name and date of birth? Thank you. My name is Jen and I'll be your provider today. I'm here to discuss with you a procedure called a paracentesis and to get your consent should you like to move forward with the procedure. Paracentesis is indicated for you because you have an excess of fluid built up in your abdomen that's causing you pain. In addition, you have a fever and a rapid heart rate, which may indicate that you have an infection. We can test the fluid that we get out of your abdomen to see what's going on and help us guide your care. Paracentesis involves using a catheter to extract fluid from your abdomen and to relieve the pressure. Again, it'll let us test the fluid as well. I'll explain the process to you. First, we'll ask you to empty your bladder. Then we'll have you lie in a bed with your head elevated or possibly on your left side. This allows us to use the ultrasound machine to make sure that your internal organs are out of the way and that the fluid pools and collects. We'll find the best spot and we'll mark it with a pen. Then we'll cleanse the area really well and drape it. And we'll use sterile equipment and procedures. Then we'll numb the skin and numb all the way down through your abdominal wall to protect you from pain, to minimize pain. We'll then insert a catheter and drain the fluid into containers. Once the fluid is drained, we remove the catheter and cover it with a sterile bandage. The risks involved with paracentesis are quite low, but they do include bleeding, infection, abdominal organ injury, leakage of fluid out, leakage of air in, and post-procedural hypotension. They're all possible risks. We minimize the risk of infection by cleansing and draping your abdomen and using sterile equipment and practices, and by making sure that we don't go through any sites of bruising or infection. The risk of procedural bleeding is quite low and minimized by ensuring we don't choose a site that has obvious veins. We minimize abdominal organ injury by using the ultrasound to visualize internal structures and fluid collections. Air and fluid leakage are minimized by using a Z-track method where we access the skin and then displace it from the access into your abdomen. The benefits of paracentesis are that you'll have some pain relief and again we'll be able to run labs on the fluid and it'll help us guide your care. Alternatively, we don't do the paracentesis. There's really no other way to access the fluid in your abdomen, and so we wouldn't have as much information and we wouldn't be able to relieve the pressure for you. I just gave you a lot of information. Can you please repeat it back to me so that I can make sure you understand and also answer any questions that you might have? Thank you.